To Deborah Mendelsohn, exercise is a key part of health and happiness.
And I've even been doing a little jogging and walking, so that's what I love.
Like many women who have children, Deb developed stress, urinary incontinence, and pelvic organ prolapse.
So if I coughed or sneezed, I'd have to, wherever I was, I'd have to go home and change, and it was really inconvenienced.
Very common. So she opted to have doctors in her hometown implant pelvic mesh for both her incontinence and prolapse. It worked for several years.
And then I developed another prolapse, so I went back to my surgeon, who did further mesh surgery.
For a while, that worked too. Then the pain began.
A scale of 1 to 10 of the pain, my pain was probably at about 11 prior to the surgery. I was extremely distressed, and to be honest, I didn't feel my life was worth living. I had no quality of life at all.
Deborah's search for help led her to Mayo Clinic and urogynecologist Dr. John Gebhardt. He says the most common problems with mesh implants are erosions or extrusions, meaning the mesh starts to poke through tissue and skin.
Could lead to bleeding, irritation, discharge, maybe complaints with intercourse.
Here's what happens. Pelvic mesh is implanted to bolster organs, to give them support. Over time, the body grows in and around the mesh, and this holds the mesh in place. In some cases, the mesh contracts and begins to move, causing potentially serious symptoms. Surgery to take out embedded mesh can be very complicated and difficult.
We removed a significant majority of the mesh that was placed for her. We didn't remove it all because some areas weren't an issue.
Deborah has had 2 surgeries to remove the mesh. Some is still there, but she feels worlds better.
Absolutely fantastic.
Now she's back on track.
I have got back into physical activity, which is great.
Back into life. For the Mayo Clinic News Network, I'm Vivian Williams.